Good afternoon, and welcome to today's webinar, Acknowledging the Canadian Public Health Week. Thank you for joining us. We are very excited to share with you key reflections and ideas from the delegates of the National Conference on Tobacco and Vaping, the 2023 year. I want to start by acknowledging that while we are gathering from across Canada, Ontario Public Health Office is located in Hamilton, situated upon the traditional territories of Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. The land is covered by the Dish with One Spoon, Wampum Belt Covenant. We further acknowledge that this land is covered by the Between the Lakes Purchase between the Crown and the Mississaugas of the Credit First Nation. Hamilton is home to many Indigenous people from across Turtle Island, and we recognize that we must do more to learn about the rich history of this land. Today, we're going to cover just who's presenting, so myself and John, Canadian Public Health Week and the importance of acknowledging public health and recognizing contributions year-round. Then we're going to talk about tobacco and vaping in Canada and how it's still a key public health issue. Then we're going to let you know a bit about the National Conference on Tobacco and Vaping, this year's event, and then explain about the full conference workshop, which is why we're here today. We will be then sharing key reflections and ideas from workshop participants, and we invite you to discuss and share your reflections. So the aim of today's webinar is to share ideas, ask questions, and share reactions. As a reminder, this session is being recorded and will be made available to delegates on the FeedLoop site, as well as publicly. We encourage you to participate by using the question and answer function here on Zoom. Please share your comments and reflections, and we'll address them at the end. And just as a reminder that in this session, when we say tobacco, we are referring to commercial tobacco and are not discussing sacred tobacco, and we respect those histories. So just an introduction of the presenters today. So John Atkinson is Executive Director of the Ontario Public Health Association, and he joined in 2022. He has over 20 years of experience in tobacco control, and he has led health promotion programs, policy initiatives in a number of settings, including health services, university health services, public health, community health, and not-for-profits. Myself is Sarah Petta, and I'm the Policy and Project Specialist here at OPHA. And I joined the Ontario Public Health Association last year, just in time to be assigned Project Manager for the National Tobacco and Vaping Conference. So prior to OPHA, I have almost 10 years experience in mental health promotion. So Canadian Public Health Week is a time to recognize the contributions of public health that are often not visible and happen behind the scenes. It's also a time to highlight issues that are important to improving health and well-being of all Canadians. We'd like to educate communities about the importance of improving health through various means such as prevention, protection, and promotion. We also want to acknowledge the relentless contributions of the public health workforce throughout challenging conditions and advocating for vulnerable sectors. So this year, we're focusing on tobacco because it is still a key public health issue. And it's very important that we take action in this sector to improve the health of Canadians. It is still a leading cause of premature death and disease across Canada. In 2020, Approximately 4 million people in Canada use tobacco products and smoke them. As we know, quitting smoking improves health, quality of life, and mental health. And it has been shown to increase abstinence from other substances. So despite the progress made over the decades in tobacco control and regulation, it remains a prominent public health issue. We know that tobacco smoke contains many chemicals that are known to trigger or promote cancer. And in 2017, the Federal Minister of Health announced the endgame goal. Various countries across the world have endgame goals, but the one in Canada announced by the Federal Minister of Health in 2017 was for Canada to have a less than 5% prevalence by 2035. And in 2020, there was approximately 12% smoking prevalence across Canadian population. The highest prevalence rate was in adults between 35 and 44 years old. Another trend that is concerning for public health is that in the age group of 15 to 19-year-olds, 3% smoke tobaccos, yet vaping in this age group doubled between the years of 2017 and 2019. And as we know, there is an inequitable impact and high prevalence groups with smoking, such as construction workers, those that have a lower education, 2S LGBTQ peoples, those with a low income, Indigenous communities, those that have mental health diagnosis, and those with substance use disorders all have higher prevalence rates. And the endgame goal wants to see less than 5% prevalence in these groups as well. So the National Conference on Tobacco and Vaping, we had the pleasure to co-host with the Canadian Public Health Association. And after 2 long years of balancing pandemic response with continued work on tobacco and vaping, we were able to get together and chart the course to less than 5% by 2035. This conference is an opportunity to facilitate knowledge exchange, increase networking across Canada, and create collaboration opportunities among leaders and frontline staff and tobacco control officers. We were delighted to have over 400 delegates, not only from across Canada, but from across different sectors. So we had representatives from Alberta, British Columbia, Manitoba, Ontario, Prince Edward Island, Quebec, and Saskatchewan. And we were delighted to have these people participate in the workshop and bring different province views to the discussion. We also were delighted to see that various sectors attended and were interested in participating in the discourse. So we had academics, community health professionals, not-for-profits, government sector, those from work in hospitals, industry, and still students. The highest group was public health professionals, followed by government workers. The objectives of this conference was to learn about the current state of commercial tobacco consumption and nicotine vaping in Canada, as well as the inequitable impacts of commercial tobacco and vaping on certain populations and strategies to address them. We will better understand the perspectives of those who use commercial and tobacco and vaping products, as well as the progress that has happened across research, policy, and clinical best practices, all in the aim to achieve less than 5% by 2035. We also wanted to better understand the impacts of vaping on commercial tobacco use, nicotine addiction, and smoking cessation. And we are delighted to say that over 96% of delegates that participated in the feedback survey felt that the conference met these objectives. We are also excited to say that we will be sharing the conference feedback on Feedloop shortly. So just some conference highlights so you can get a picture of how the event went. We had 52 speakers from across Canada and internationally. There were 12 host presentations that shared the latest research on tobacco and vaping in Canada and explored current surveillance data. We also were able to showcase the stories of people with lived experience who were able to share their stories live and engage with delegates through questions. We also had international perspectives and inspiration from Finland, New Zealand, Switzerland, the UK in the Cochrane Review, as well as the United States. And then all of those people and perspectives were brought together in one full conference workshop. On the second day, after inspiring keynotes, addresses, symposia, concurrent sessions presented, advocates and advances in tobacco control, the conference brought together steering committee members, speakers, presenters, and delegates from across sectors and jurisdictions. Facilitated by John Atkinson, the workshop had over 250 participants, 20 breakout rooms. So it was a very ambitious undertaking where participants brainstormed priorities for action in tobacco and vaping control in order to achieve charting the course to less than 5% by 2035. And in these discussions, we considered policy, practice, and research angles. This was the tool that was used throughout the workshop. So delegates were able to put down ideas, ask questions, deliberate, and have conversations with their breakout group rooms. And how we got here today is we're sharing them. I tallied all of the results. We took them together, we themed and coded them, and put together recommendations from all the delegates of the conference. And John will be here to share them with you today.
Thank you, Sarah. Thanks everyone for attending today. We have a great turnout, over 140 people who have attended today. I'm guessing that some of you were at the conference, maybe some of you were not. Just keen to find out what people discussed during the workshop and what their recommendations were for how we should get to less than 5% by 2035. If you were at the workshop, you would realize it was indeed an experiment. It was a little bit messy, but it was certainly dynamic, and there was a lot of discussion, brainstorming, and we could see 20 different whiteboards, Miro boards being used, and sticky notes and notes all being placed in terms of how people felt the research, policy, and practice-based solutions should be put in place in order to reach this this goal. Next slide. So things to note, kind of from the top, when we look at the all the categories or themes of findings from this workshop, there was a real feeling from participants that the status quo was no longer acceptable and that bold action really needed to be taken to achieve an end game goal in Canada. So in addition to that, there was lots of discussion about the actual goal itself, the less than 5% by 2035. And what does that mean and what should it include? So questions about whether it should just be tobacco use prevalence, whether it should be focused on nicotine use, whether it should include both tobacco and e-cigarettes, and comments about getting to less than 5% tobacco prevalence, that we wouldn't really be achieving an end game unless we were also considering the impacts and the prevalence around youth vaping, without being clear on what those impacts will be long term. Just just of note, we were a little bit surprised to see that there weren't a lot of strategic or a lot of strategies or specific measures to address tobacco use and vaping amongst high-risk population groups. It was a 1-hour workshop, so perhaps time limits were part of that. Certainly, there was an equity lens that we saw throughout the feedback and the measures and the suggestions and ideas that were given, but not clear strategies. So there's certainly more that needs to be thought about on that side. But to give you some of the quotes around some of the health equity and inequitable impacts of tobacco, what people had mentioned, really addressing the harms of colonization and intergenerational trauma, especially in Indigenous communities, highlighting how we use language and aligning it with Indigenous ways of knowing. So really being respectful of First Nations use of sacred and traditional forms of tobacco versus commercial tobacco. And then really looking at health equity approaches with Indigenous peoples. So that includes resourcing, programs, supports that are co-designed or led by those in Indigenous communities who have ways of knowing of how best to address the needs of their own community members. And then there was quite a bit that was mentioned around mental health. In general, greater access to mental health and addiction services, both from a preventative standpoint, but also in terms of supporting individuals who are addicted to nicotine. Looking at ways to support people around coping with the stressors of life and those mental health issues. And looking at how we can promote kind of cross-pillar work between mental health and substance use prevention work. Next slide. So there was an overarching theme of input around really needing a comprehensive strategy with many measures across policy, program, and research directives that address and measure reductions in tobacco use and vaping. Some said an actual operational or work plan that backs up strategy with an actual implementation plan. Collaboration came out as key to making this happen. So how can we connect stakeholders who work in these sectors, create shared goals, and how do we do this across all levels, both geographically, but policy-wise, and across the various practices within the sector. And then how do we create synergy between national and provincial strategies? So having a federal strategy is fantastic, but a lot of work does happen at the provincial level. So really creating synergy between those levels. And in addition to having policy and an implementation of how to implement them, that there needs to be measurement. So how are we doing? And then how are we enforcing policy to ensure that it's actually effective? When talking about collaboration, communities of practice, committees, coalitions were all mentioned to enable this collaboration, share lessons, and strategize together. And benchmarking and standardized measurements was also mentioned as being important. Having targets or benchmarks for all levels will enable both folks like public health units at a local level to work towards these, but also provinces and national goals that we can set and work towards. So really addressing the how was important. There have been strategies in the past without the how included and the ways that these were going to be accomplished, so that was emphasized. And really bringing back a need for advocacy for policy change. So how can we influence policy and how can we engage? There was mentioned several places where youth engagement and youth advocacy for policy change was really powerful in the past, and how that should be brought back. And then how do we get actual formalized networks set up that we can engage folks at all levels in a kind of systematic way? So I'll give you a couple of quotes in terms of this theme that folks said. An intensive and comprehensive policy and set of interventions to protect youth and young adults from vaping, age restriction, online retail monitoring, enforcement is needed. Reconnecting with community partners post-pandemic, a standardized strategy around vaping and cessation and consistent messaging is needed, and advocate for buy-in from governments for health in all policies. We need to recover from the pandemic and learning how to integrate health into all of those policies. And finally, a national framework redeveloped with provincial agreements so there's alignment across jurisdictions, and to include an age-out plan like the New Zealand model. On to the next theme. So the next one is really around policy changes around tobacco and vaping. And so the first kind of set of recommendations were really around accessibility in terms of limiting accessibility by age. So looking at age 21, there was suggestion of even 25 in order to prevent or reduce youth initiation. There was also suggestions about, there were a number of folks who felt that we should pursue a tobacco-free generation policy like New Zealand, but perhaps phase it. Start with age 21, then move to a tobacco-free generation. A couple suggested. And then how do we actually decrease demand? So denicotinizing or decreasing nicotine in cigarettes was suggested. And then a lot of discussion and recommendations around accessibility and availability of these products, both tobacco and e-cigarettes. So how can we reduce retail availability? So limiting retail density, and then even looking at a neighborhood or geographic region and reducing availability based on health equity kinds of considerations. So those most vulnerable or the higher risk populations. And then really looking at how we utilize licensing, enforcement, and penalties for non-compliance in order to enforce this. There was quite a bit around regulated outlets. So looking at reducing the number of outlets overall, looking to learn from a kind of public health approach where cannabis legalization and regulation has been used, where there are regulated outlets specifically for the product, but with need for reduced numbers and hours of access overall in order to reduce youth access, but access overall. Some quotes included, we need bold actions from governments. We know what to do, but we need a political will to act. Another person said, or another group said, follow New Zealand's lead in innovative policy actions. Be willing to try something new. In terms of age restriction, a couple of quotes, increase or raise the age of purchase to 21 and the age of smoking to 21 and include cannabis. In terms of sales restrictions, prohibit sales outlets for tobacco and vaping products within a 5-kilometer radius of underprivileged neighborhoods and areas frequented by young people. And align work with recommendations with other legalized psychoactive substance work like alcohol and cannabis. Okay, next theme. The next one was around more regulation around the vaping and e-cigarette industry. So many groups suggested that there needs to be an actual increase in regulation around the products, and that includes nicotine levels. So either having standardized or set maximum nicotine levels, regulating the actual components or ingredients used in e-liquid. So that might include full disclosure of ingredients, listing harmful ingredients, those kinds of things, or banning or eliminating certain kinds of ingredients that might be known to be harmful. And then enabling things like package restrictions and marketing on the package, not dissimilar to tobacco. Elimination of flavoring was discussed in many groups, and banning disposable e-cigarettes was also mentioned. Some of the quotes that came out from this was to market, the marketing of products should be plain packaging for vape products. So really implementing plain packaging with e-cigarettes. Regulate vaping industry more tightly. Disclosure of vaping recipes. Ban any chemical known to cause respiratory issues or cancer. And standardization of vape devices, such as level of nicotine, composition of liquids, etc. And finally, put health warnings on vapes. Propylene glycol, for example, when heated thermally, degrades to a class B carcinogen. That was a suggestion from one group. And then you can see other suggestions on the, or ideas on the slide included prohibiting internet or restricting internet sales, especially for young people. Okay, next theme. So the next theme is social marketing campaigns. So within the idea being within a comprehensive strategy, that social marketing needed to be an element of that, both from a prevention and a cessation perspective. So driving individuals or motivating them to quit, and or educating and trying to shift attitudes amongst young people to prevent initiation. Also using social marketing across various platforms and channels to be able to share research, use knowledge translation methods for effective knowledge dissemination, and to look at really targeting various subpopulations within campaigns, both adults and youth, as well as those who are at higher risk for vaping or tobacco use. Next slide. So quite a bit was discussed about strategies to address youth and vaping. Lots of concern in this area. So really looking at peer-to-peer health promotion models and evidence so that young people can reach out to youth and inform their decision-making in relevant and engaging ways, and using channels that speak to young people, such as social media or online means. The need for more prevention programming. Schools were discussed a lot. So one quote was from one group was to address vaping in schools from a comprehensive school health perspective. Another one was looking at funding programs to support prevention in schools, as well as quit attempts for young people in schools. And shift from punitive consequences for youth addicted to vaping and focus on helping and finding alternatives to stress and coping for them. And then look at how we can use best practices for engaging parents and families of young people and supporting parents to learn more about vaping and how to support their children. And then what's the root causes? Why do young people actually vape and become addicted in the first place, and looking at how we can address upstream protective factors for young people. Next theme. The next one's all about eliminating barriers to treatment. And this was really from a perspective of smoking cessation, but also e-cigarette use and cessation as well. So a lot about just increasing, there's not enough accessibility to quit supports, increasing treatment options for those looking to quit. And that includes full and equitable access to NRT. That is not consistent across Canada. So, and where it is, it may be limited. So increasing access across the board to that nicotine replacement therapy, and that it's freely available for all. Increasing trauma-informed supports and behavioral supports, such as through behavioral counseling, and expanded hospital support, both hospital and primary care, so healthcare-based solutions, and providing population-based kinds of supports for those who leave inpatient services. So really having those wraparound support services. Groups cited the need for outreach programs, especially for higher prevalence populations, and that integrated intensive treatment is the most effective in making that available. With that said, more population-based, so less intensive services were also needed, and that would be enhancing and beefing up or making more robust quit line, online, text messaging, and other kinds of services available. Groups talked about nicotine replacement therapy improving the odds of quit attempts, of successful quit attempts, and funding for more than one quit attempt, and pairing counseling with pharmacotherapy wherever possible. More use of and greater access to motivational interviewing was shown to increase readiness, and so greater access for that, and really being patient and client-centered, allowing individuals to identify their treatment and make informed decisions and share options with them. So a couple of quotes from this theme. One was investing more in mental health and the social determinants of health. Another was to have NRT products covered by provincial benefits, such as OHIP in Ontario, but also making all, not just NRT, but other pharmacotherapy fully covered drug for all individuals. Okay, on to the next theme. Research. So research was one of the categories where people were asked, what do we need to learn more about? So the first was really understanding more about e-cigarettes. What is the current and evolving as these products change, ingredients and their impact? What are in all the various products, and over the long term, what are the long-term effects of vaping, measuring that over time? Getting a better sense of data for diverse populations, so having better access to tobacco use and vaping for high risk or diverse populations, and being able to identify what those diverse communities need in order to identify what's needed from a support perspective. Increased research funding was very much highlighted to be able to enable all sorts of different kinds of research, and really looking at best practices in prevention and other kinds of support. People also talked about learning more about, especially with legalization of cannabis, but also alcohol and other substances. How does that impact both tobacco use and vaping and co-use or poly-substance use across all of those different substances? And also, how can e-cigarettes be used for harm reduction with certain populations, such as pregnant women, for example? People spoke about, while the Cochrane review was really helpful that more randomized control trials are needed to learn even more about e-cigarettes and how they can be used for smoking cessation. And then continued research about how e-cigarettes can influence or do influence tobacco use, whether that's from an initiation standpoint or continued use of tobacco over a long term. And finally, population level surveillance at all levels, really understanding where things are going from a tobacco use and e-cigarette use perspective. Okay, the next theme we saw come out was around funding. So if we are actually going to reach the end game goal, there needs to be a greater investment across all levels. There are comments about decreasing levels of funding over time, especially at the provincial level, not all provinces, but many provinces. And so more needs to be invested. There needs to be greater capacity, human resources. There's been attrition of those working in the sector. And so there needs to be greater capacity to be able to, to do all of this work, whether it be research, policy, or providing practice-based or program-based solutions. Greater funding is needed for enforcement, so the implementation of policy and its enforcement, but also to support that actual workforce in terms of professional development. And some of the previous supports that existed, the glue across the workforce in tobacco control went away a number of years ago, and that funding needs to be reinstated, and there needs to be folks who are facilitating that professional development, collaboration, and learning across the sector. And then finally, one point, not one point, but several points around funding for research. And that, without funding, research is not able to be done. And so it is often limited, and the priorities and opportunities are limited because the funding is limited. And a couple of quotes to finish off this section would include increased funding for more tobacco and vapor enforcement officers and reduction coordinators, and enforcement and education of retailers is needed. Another quote from one group said, funding's needed, bring back Propel. So that's the Propel Population Research Group from the University of Waterloo, and update Canada's 5% goal to include vaping. And human resources, capacity, exclamation mark, exclamation mark, exclamation mark. We need more of it. Okay, and our last theme before we summarize and then open it up for questions and your reactions and insights is really around the inequitable impact on certain communities. So as we mentioned, there weren't specific strategies outlined, but really more how we should be looking at addressing the inequitable impact of tobacco use and vaping. One was to engage, as you know, we had people with lived experience at the conference, but that we need to be doing that for all measures across the board, so that those who are most impacted are informing the strategies and feeding back as we go along as to how things are indeed working at a community or individual level. More culturally competent strategies, especially with work with Indigenous communities, and that includes with non-Indigenous organizations partnering or engaging with Indigenous communities, but also for Indigenous-led strategies themselves, those strategies. And engaging Indigenous communities more often and frequently to better understand needs so they are adequately incorporated into strategy and implementation measures. Reach equity was talked about. So while services or supports or programs may be available, they don't necessarily reach everyone and not equitably. So those who often reach, can access programs are those who have means, have knowledge, have access, are in the know, who pursue that information. So how do we increase reach equity? And then more Indigenous developed and led programs, so funding for those to be able to be developed and led by those community leaders, organizations. And finally, a greater need to have cessation support with those with mental illness and mental health issues, just greater availability. And I think that echoes the earlier points around accessibility to mental health supports and treatment. So that brings us to the end of all of the themes. So a lot absolutely came out from this workshop in terms of tangible policy, research, and program actions. But just to summarize before we open it up for questions, your thoughts, your reactions, is that there needs to be greater collaboration and coordination amongst stakeholders, and we need to take bold and collective action in order to actually achieve the 5% by 35 goal. We need to reduce access to tobacco, commercial tobacco, and vaping products, and that's through increasing age and reducing retail access. We need greater regulation of the e-cigarette industry, as I had mentioned, some of what those suggestions were. We need to reduce barriers to treatment, fully funded, free, and available access to NRT and counseling, as well as upstream supports and protective supports that address the social determinants of health. And we need to increase awareness and education and motivate behavior change through social marketing campaigns, and that we use knowledge translation best practices with clear, targeted messaging, not just broad population-based messaging. And finally, we need to continue to build the evidence base so it can inform our work, but also tell us how our work is having an impact by funding research robustly and formulating best practices. So thanks for me. That felt like a bit of a marathon to go through all of that feedback. So I think we're going to move now to your, again, Sarah and I, just to kind of frame this next section, the next 15 minutes of our time together. Sarah nor myself or the conference organizers, we aren't experts in these areas. While I've worked for a couple of decades, I don't have expertise in all of these areas. So it's not so much questions for us. It might be questions about the results of what people spoke about during the conference, but we're also looking to hear about your thoughts and reactions to what we presented today. And if you felt that there was something missed or things that were missed on how we need to get to a 5% by 2035 or the goal itself, we'd love to hear your thoughts. So we will go through them and address them one by one as they come in.
Great, thank you, John. It was clearly a valuable and rich discussion throughout the workshop. And so I'll start with the questions. So hi, Melanie. You mentioned that you joined late, but it is being recorded and you will be able to find it again for future. It will be available on YouTube as well as for conference delegates on Feedloop. So we hope that you come back, look at this, and hopefully use it as inspiration for direction.
So I can read the next one out. There's a question that says, has teen vaping contributed to the historically low levels of teen tobacco use? I think that's an interesting question. I don't know the answer to that. I would say that's a hypothesis. I don't know that evidence has shown a causal link between the two, but an interesting question that we could certainly pose to some of the researchers that work in the field. Do you want to take the next one, Sarah?
Sure. So the next one is, thank you for this update. I agree that bold action is the only way to reach this goal of less than 5% by 2035, and New Zealand is paving this path. What are the next steps with all of this information? Well, I think, John, you can input in this, that we use this as a guide to inform action and direction in tobacco control.
Yeah, I think, this was a workshop where people came together and shared their ideas. Our hope would be that folks can then take this, and whether it's within their own organizations, or it's their advocacy, or their input to government, or their work with other fellow partners within the sector, that this would be good food for thought in terms of influencing, the next and future strategy that happens both at political and national levels. And so, and I think we as OPHA, and certainly when we've worked with other public health associations like the Canadian Public Health Association, we look for ways to facilitate collaboration and coming together on certain issues. So we will be looking for, within what we're able to do over the coming, this conference happens every 2 years, but we don't want to come together only every 2 years. So we'll be looking for opportunities on ways that we can bring folks together to collaborate on some of these issues. And I'm going to excuse myself for a sec because I'm going to sneeze. One sec. It was a false alarm. The next question is, could ex-smokers who quit by switching to vaping and now run vape shops be trained in promoting smoking cessation? I think that's an interesting question. I certainly think it's possible that that could be the case. I think certainly smoking cessation is something that does require experience and training, intensive behavioral counseling, usually with paired with pharmacotherapy, is what is shown to be most effective. And so I think often those who are trained and educated in that, obviously have the qualifications to be able to do that. But an interesting thought. And again, this is just my editorializing. I'm just giving you my thoughts. The next comment is that contraband tobacco sales throughout Canada is increasing. I'm not sure if that is the case, but thank you for your comment. And then there's a comment, when will more resources be allocated to prevent this occurring? We need users of combustible tobacco products to switch to better options in their smoking cessation model. So when will more resources be allocated? I think that is certainly something that was raised at the conference, and that numerous those working in tobacco and vaping have been raising for a number of years, that there needs to be not only sustained but increased investments in tobacco control and vaping. Our work is not done. A lot of recent governments, we've heard comment on that tobacco is done. And this is not universal across the country, but certainly it is not, and there needs to be increased resources. So thanks for your comment.
And so the next question would be, thanks for the presentation. Do we have a tobacco control strategy for all of the provinces in Canada, as this will help to implement policies uniformly? And I'll put that over to you, John.
Sure. So I wish Rob Cunningham was here, and maybe this is a topic of a future webinar. There certainly is a federal tobacco strategy that exists. And then depending on the actual province, there are varying levels and degrees of strategy or investments made in tobacco control. They are not uniform, and they aren't necessarily designed to be synergistic with the federal strategy. So there is work that needs to be done there. There are provinces where there was robust strategy that previously existed that no longer exists. There may be a suite of funding that that is dedicated, but not necessarily in the form of a strategy. So it varies, and I think there needs to be, as per the recommendations from the workshop, there's room for improvement there. And certainly as we look at getting to an end game perspective, the delegates certainly felt like that needed to be pursued. Shall I take the next one? Sure. Not a question, but a comment. I feel engagement with multi-provincial departments would be needed to address the inequities in cessation aids. For example, in public health, we need to engage with the Department of Community Services to ensure funds are available to support several quit attempts. As well, we need to consider those incarcerated. So would agree, I think if you go to some provinces, you can say that there is funded or supported smoking cessation supports available, but that is not the case for all. And as we heard from some of our keynotes at the conference, one course of NRT, for example, is not necessarily enough, especially for those who are quite have high levels of addiction, or who might have other comorbidities or challenges with addiction, etc. There is certainly more needed. So coordinated with those provincial authorities, I think, and across would be helpful. You want to do the next one?
Sure. An anonymous attendee asks, is there a conflict of interest when the conference was sponsored by a manufacturer of a medical nicotine replacement therapy?
It's an interesting question. I don't know specifically what the conflict of interest is, just a general conflict of interest maybe being asked. For a number of years, the national conference has had, a variety of sponsors, and one that's been consistent has been, and there's been numerous actually in the past that have produced nicotine replacement therapy. I can certainly speak on behalf of the Ontario Public Health Association, because nicotine replacement therapy is a evidence-based and supported pharmacotherapy or cessation aid, and it has from a long-standing basis been a part of advocacy and position for our organization and others in the tobacco control sector, that increasing access to this will decrease the prevalence of tobacco use and support those who are addicted. Certainly for this past conference, we did not feel that it was a conflict to have a manufacturer of NRT as a sponsor. Thanks for your question. Next one is, especially for policies on supporting free NRT to promote smoking cessation. Great, thank you for your suggestion. Go ahead, Sarah.
This is a comment. The TVPA, reviewed by Health Canada, offers updated information for Canadians seeking a less harmful alternative to combustible tobacco, and has updated their website as well to reflect their views, and then shared some resources. So thank you so much for that. Richard Gould says, might Health Canada organize a planning workshop to develop concrete and more specific proposals for updated policies and actions to move towards the 5% goal?
So that's a good question, Richard. Thanks so much for your question. That's certainly something that we, and I'm not saying we as OPHA, but we could be, as part of the voices, could ask Health Canada for this kind of workshop. To help inform. I mean, I think the national conference workshop could be a good starting place for that. There's a lot of good information that came out from that workshop, but I think that would be beneficial, sure. And I think we could be those attending, all the individuals and organizations, and Health Canada and or provincial health ministries as well would, from my perspective, would be of value to do that at a provincial level. Great. Next one is, I'll take this one, Sarah. Sound good? How can nurses supporting schools best send the anti-vaping message to their students and highlight all the possible negative health implications? That is a really good question, and I don't know is one that I or Sarah can answer directly, but I think that's certainly something that was reinforced when or echoed when we looked at the findings from the workshop. Supports for comprehensive school engagement with actual youth engaging with youth, but also engaging with families around e-cigarette use and vaping was something that was seen to be needed. So sorry, we can't answer that directly today.
And the next comment is from Christine Federley. The network of invested stakeholders you've engaged through the OPHA and CPHA conference, is there a way you or we could openly set up a platform for engagement on noted points of work to be done, addressing specific populations, for example? Enforcement is another. If we had a place to go for contacts, work and play, it would help us collaborate and do more work moving forward.
I think that is an excellent suggestion, Christine. I mean, OPHA would be really happy to help play that role. I think what it comes down to is our own capacity. So if there was funding to support us to be able to do that, we certainly will do our best to try and facilitate work in both community collaboration and work in both community and public health sectors, but we're a not-for-profit organization, so we are limited by our current resourcing. So, but I do think that is, as the workshop attendees said, is needed, and we would be happy to do that if if we could find some sustained funding to support that. And that's something that we could look for, sustained funding to support. I think we'd be happy to help with that. I just want to flag it's 12:57, Sarah. We have a number of other questions. Thank you so much for all of your questions and comments. So we're not going to be able to get to all of them. Maybe we can take one more. Sarah, what do you think?
Sure. Did you have a preference? I'll let you select the last one.
Sure. I'll pick the last one. So why don't we? Okay, there's a question. Not sure if this has been asked already as I joined late. How does vaping fit in the goal picture? Can shift from smoking to vaping? Oh, it just disappeared. So I can comment that there were a number of like broadly across the groups, there was a question about the 5% by 2035, and that this goal, that we should think about how the goal applies to nicotine overall and e-cigarettes, and some saying it should be expanded, the 5% should be expanded to include vaping. So thank you for your question. I think that's all we can take for today, just because we have an hour and we only have a couple of minutes left. But I want to thank you very much for all of your great contributions and questions, and there's lots more, unfortunately, that we can't get to.
Yes, thank you all.
All the more reason why we should come back together, and we should keep collaborating, working on these issues together.
Yes. And so as we wrap up, I just wanted to wish everybody a happy Canadian Public Health Week. It is the second Canadian Public Health Week, and we just wanted to celebrate and promote public health in your community. I hope you've had the chance to recognize colleagues, both working in the tobacco and vaping control field, as well as across community and public health in Canada. I hope that you've either been able to promote or engage in healthy behavior this week and take care of yourselves as we transition from redeployment and pandemic response to all of the other issues that face us in Canada. So beyond Public Health Week, we would love it if we invite you to join us and become a member of the Ontario Public Health Association. We are a member-based organization that advocates for health in all policy across various issues, and our members are really the strength and drive for this. Most recently in the Alliance for Tobacco-Free Ontario 2023. There was a joint submission with recommendations to support the health of our communities and reduce the burden on the healthcare system. And so we continually work together to achieve optimum health for all. And if you'd like to find out more, please visit the OPHA website. We'd love to hear from you. So thank you again for joining us today and being a part of this conversation.
Yes, thank you so much. And thanks to all the attendees for trusting the process, for using the Miro boards and sticking up all the various sticky notes, and for the really robust discussions that you had within that hour workshop. I think they're really good food for thought and a good foundation from which we can collaborate and work moving forward. So again, thank you so much. We hope to see you in a couple of years at the next conference, but we certainly do not want to wait that long. So we will look for opportunities where we can reach out. Obviously, becoming an OPHA member is one way that we can help facilitate that. But I think Christine's comment, we'll certainly look at ways that we might be able to facilitate more collaboration around these needed and potentially very exciting ways that we can get to that end game goal. So thank you once again. Happy Canadian Public Health Week, and thanks for attending today's session. Bye.